Guys, welcome to chapter 2. So this week we're going to be talking about making ethical decisions. Let's talk about needs-based motivation. So needs-based motivation is a theory that human behavior is based on specific human needs that must often be met in a very specific order. Abraham Maslow is the best known psychologist for this theory. He has the Maslow's hierarchy of needs. The five needs in Maslow's hierarchy can be represented by a pyramid as you see in this picture here. So let's cover these quick. So the D needs or deficiency needs, number 1, need for basic life, so food and shelter. We all as humans need food and shelter to live. Need for a safe and secure environment. And need to belong and be loved. Then there's also B needs or being needs. Number 1 is the need for esteem, need for self-actualization. So all of these things together, it's almost like you have to meet the very bottom layer before you can move up to the next one, and then so forth. So before we can actually reach that top self-actualization point, we have to meet all of the points below. And then let's talk about some value development theories. So many psychologists believe that individuals move from needs-based motivation to a personal value system that develops from childhood. When we are born, we have no values. They all have to be taught to us. The value system we develop as we grow and mature is dependent on the cultural framework in which we live. So our cultures can cause it to vary, our parents and what our parents learned when they were children, all of that factors into how we learn and grow. Jean Piaget and Lawrence Kohlberg are the best known psychologists for this theory. So let's dive a little bit deeper into these different stages of development. So stage 1, sensory motor, usually occurs from about birth to 2 years of age. Children are very self-centered in this age, obviously. They're very dependent upon their parents. They explore the world with their 5 senses and cannot see from anyone else's point of view. Everything's about them. Stage number 2 then, pre-operational, is about from age 2 to 7 years of age. Children are very egocentric at this age. They view the world from their own perspective still, but they're starting to develop an awareness of things and people, even if they're not in their own direct sight. Stage 3, concrete operational, is about from ages 7 to 12. Children tend to see things as either right or wrong, so very black and white, and see adults as powerful and controlling. And then the last stage, formal operational, is from 12 and up. So children develop abstract thought and they start to understand that there may be different degrees of wrongdoing in their lives. Then we have Kohlberg stages of moral development. So level 1, pre-conventional morality. People like to avoid punishment, they're egocentric, and accept authority of others. Self-interest stage recognizes that there's more than one view as to what is right and wrong and begin to look at their own self-interest. And then level 2, the conventional morality, is what's called the good boy attitude, where children are focusing on following the expected social conventions and demonstrating good intentions. So they want to do what's right, they want to be good. And then there's also law and order morality, where they are becoming more aware of doing one's duty. Focus is on the rules and respect for authority. So they want to kind of follow what is expected to them and to meet all those standards. Then we have post-conventional morality. So social contract, people start to explore how to balance individual rights in a fair society for all. And then lastly, universal principle. So personal commitments to social justice, equal rights, and respect for the dignity of all people. They also get the realization that conventional norms and conventions are necessary to uphold society. So once again, just like Maslow's theory, you kind of have to hit that very bottom tier before you can go to the next one up and so forth. You can't really get to that top tier until you've already passed by the ones below it. So next we're going to talk about the different value choice theories. We're going to go over some consequence-oriented theories, duty-oriented theories, and virtue ethics. So first let's talk about the consequence-oriented theory. This is also known as the teleological theory. It judges the rightness of a decision based on the outcome. So something that is a positive decision has positive consequences, and then something that's a negative decision has negative consequences. It also involves the principle of utility, which states that an action should maximize the overall happiness of society. Sorry about the outfit change. I got sidetracked yesterday and I'm finishing this up today. So next we have deontological or duty-oriented theory. This focuses on the essential rightness or wrongness of an act, not the consequences of the act. Immanuel Kant is the founder of this theory, and Kant's theory stems from the belief that humans possess the ability to reason and understand universal moral laws that they can apply in all situations. Enforcement is then made possible by penalties for disobedience. This can include fines, imprisonment, or both. And next we have virtue ethics. Virtue ethics focuses on traits, characteristics, and virtues a moral person should just have. Someone who has practical wisdom, a sense of justice, and courage will always make the right decision. Alistair McIntyre is the most well-known virtue ethicist. Critics do worry, though, that sometimes virtues that are most important can be subjective. So one person may think that these virtues are the most important, while another person may have a totally different viewpoint of what they find to be important. So sometimes it can be kind of hard determining whose ethics, we'll say, are better. Then we have steps in ethical problem solving. So there are several steps when we're framing out ethical duties, we'll say, that should be followed by healthcare professionals, including dental-related professions. Number one, describe the problem. Identify the principles involved, who will be affected by this decision, and who is ultimately in charge of making the decision. So kind of all the basics of the problem. Next, you want to start collecting facts. Be sure to differentiate between fact and opinion. So how we feel about a situation may not be the facts. We just want to gather facts at this point. Are there any legal problems involved? Has the problem been solved before? Like, has it occurred before? And what was the outcome of that? And is there any documentation that exists to prove that? Next, we want to list options. As many as possible is best, even if you may feel like the option isn't the best and on the lower end of the options, still include it as an option, just so you can really weigh and juggle each possible option for the best one. Next, you want to evaluate the potential options that you just listed. Who benefits by the decision made by these options? Who does not benefit? What principles are maintained? What principles may need to be sacrificed? And what kind of theory are you going to use to accomplish? Next, you're going to make your decision and act upon it. So you're going to hopefully choose the best option available from your list. Next, we're going to be talking about a few principles of healthcare ethics. So there's a few listed here. We're going to be talking about them more in the following slides. First, autonomy or self-determination, beneficence, non-maleficence, justice, confidentiality, role fidelity, and veracity. So first we have autonomy or self-determination. This is the capacity to be one's own person, make decisions on your own, for your own reasons, and not be manipulated by anyone else or any outside forces. It's characterized by competency, the ability to act on the decision, and respect for the autonomy of others. Next we have beneficence, which is to perform acts to help people stay healthy or recover from illness. You can promote health for the patient above any other considerations. Next we have maleficence, which essentially means to do no harm. Technology has made this principle difficult to follow, and many drugs and treatments have the power to heal, but may also have serious side effects as well. So it may be doing good in one area, but it's harming the patient in another area. The benefit to the patient must always outweigh the risk of harm. Then we have justice. Justice is what is due an individual. So many would argue that everyone is entitled to health care regardless of ability to pay for the care. Others argue that people must take responsibility for their actions before assuming they can have justice. Then we have confidentiality. Healthcare professionals must always protect patient privacy, HIPAA. HIPAA mandates privacy and confidentiality of medical records, and healthcare professionals are in the most likely position to violate confidentiality rules. And role fidelity. Role fidelity is where each healthcare practitioner has a specific scope of practice for which they are licensed, and they should not be doing things outside of that scope. They must remain faithful to their roles and not practice in an area in which they are not licensed. Then we have veracity, which is truth-telling. has always had an ambiguous place in the healthcare professionals' world. Consider the role of placebos. So essentially, if someone is given a placebo drug and they're not told that it's a placebo and they're made to feel like it's helping them and changing them, is that very truthful? Is that harming the patient at all with the lie that you're pretending to give them an actual medication, but in fact it's one that doesn't do anything? So that's always been kind of a controversy in medical.